Hello dosto, how are you? Once again welcome back in our channel E-Study World. Myself Dr. PS Rathore आपका स्वागत करता हूँ. I hope you are very well and enjoying your study. So once again we with the topic joints of the skeletal system and disorder of the muscles and bones. So in this topic we will discussing about whole body joints and disorder of the muscles. So let me start our topic joints of the skeletal system. Joints. What is the joints and how it works and what type of the joints? So we are discussing about what is the joint. Joints is the articulation between two or more than two bones. Joints can be fibrous, cartilaginous and synovial. Mainly three type of the joints at the standard of the 12th and entrance examination level, competitive examination. So here we are discussing about three type of the joints: fibrous joint, cartilaginous joint, and synovial joint. Joints is necessary for the movement and locomotion. So let's start. Joints are essential for all type of the movements involving the bony parts of the body. Locomotory movement are not exception to this. These joints are point of the contact between bones. Here, two or more than two bones are contact and forms a joint. Between joints, cartilages are present, may be and may not be. In which cartilage is present, this is cartilaginous joint. In which cartilage is not present, this is synovial joints. In fibrous joints, cartilage is modified in sutures. Force generated by muscles is used to carry out the movement through the joints. Here, मसल्स के द्वारा जो फोर्स जनरेट किया जाता है उसको कैरी आउट करने के लिए जॉइंट्स की जरूरत होती है. जॉइंट्स के द्वारा ही मूवमेंट कराया जाता है. वेयर द जॉइंट्स एक्ट एज द फल्क्रम. यही एक ऐसा पॉइंट होता है जहां पे हम फोर्स को अप्लाई करके मूवमेंट करा सकते हैं बोन्स का. द मोबिलिटी एट द जॉइंट्स वेरी डिपेंडिंग ऑन डिफरेंट फैक्टर. मूवेबिलिटी जॉइंट्स की डिपेंड करती है डिफरेंट फैक्टर्स पे. It is free movable, it is unidirectional movable, it is bidirectional movable, and it cannot be movable. Like in fibrous joints, joints have been classified into three major structural forms. Joints three major structural form में classify किए गए हैं, namely fibrous, cartilaginous, and synovial joints. These are three joints. In the case of fibrous joint, do not allow any movement. Fibrous joint movement allowed नहीं करता है. This type of joints is shown by the flat bones, skull bones, which fuse end to end with the help of dense fibrous connective tissue. Tissue in the form of suture of the to the form the cranium. Fibrous joint, skull and pubic symphysis. बॉडी में दो जगह पाया जाता है, स्कल एंड pubic symphysis. Cranium completely composed of fibrous joints. This is the end to end articulation of the bones. So by the fibrous connective tissue, it forms suture in the form of suture. It is present in the form of suture. In the cartilaginous joint, bones involved are joined by together with the help of cartilages. In the cartilaginous joint, not free movable but partially movable joints, and cartilages are present between two bones. Articulation surface. Joint between the adjacent vertebra in the vertebral column is of this pattern. In the vertebral column, in between two vertebra, cartilaginous joints are present. In whole vertebral column, cartilaginous joints are present. This permit little bit movement, but not removable. And this also articulate with the sternum by the cartilaginous joint. Synovial joint. Synovial joints are characterized by the presence of fluid-filled synovial cavity. In the synovial joint, this is the freely movable joint. Synovial joints, fluid-filled cavity are present between articulating surfaces between two bones or more than two bones. Articulating surfaces of two bones, such an arrangement allowed considerable movement. ये एक अच्छा खासा movement allowed करते हैं. These joints help in locomotion and many other movement. यही साइनोवियल जॉइंट ही है जो हमारी बॉडी के मूवमेंट में एंड लोकोमोशन में इन्वॉल्व होते हैं. These joints are involved in the movements and locomotion. These joints are ball and socket joint between humerus and pectoral girdle. देखा होगा head of humerus and glenoid cavity of scapula, pectoral girdle are involved in these joints. We will discuss in detail and we will show you hinge joint, knee joint. This is the hinge joint, and you can see in this one, this permits freely movable of the bone. Pivot joint between atlas and axis, and also an additional pivot joint is present in our limb between radius and ulna. Between radius and ulna, pivot joints are present. We will show you gliding joint. Gliding joint carpals, between carpals, gliding joint present, and between metacarpals, sorry, tarsals, also gliding joints present. Between tarsals, gliding joints also present. Saddle joints. Saddle joints are present between carpals and metacarpals of the thumb. Only between carpals and metacarpal of thumb. These are the some synovial example, synovial joint example. I want to show you. Let me show you. This is the fibrous joint. These all are the fibrous joint. Yeah, you can see here. Fibers are articulate to each other of two bones and forms the suture. These are the fibrous joint. This not allow the any movement. It does not permit any movement. Yeah? It joins the bone tightly and does not allow any movement. In skull, only single bone which allowed the movement. You can see jawbone. This is jawbone. Jawbone only permits the movement by the temporal bone. This is lambdoid suture. This is sagittal suture between the two temporal bones, left and right, and this is occipital bone, lambdoid suture between the occipital and temporal bones, and here temporal and occipital bones. This is also a joint. I want to show you This is sagittal suture. This is sagittal suture, right temporal parietal bone and left parietal bone. And this is, here you can see temporal bone, red in color. This is temporal bone, and this is frontal bone. This is frontal bone. Here coronal suture. These are the coronal suture between parietal and frontal bone. These all are the fibrous joint. You can see here. This is jawbone, mandible. Here, this is synovial joint, and rest of these all are of the joint are fibrous joint. Only here movements are present of the skull bone. These are the sutures. You can see here. These all are these two bones joints and makes the suture fibrous joint. These all are the sutures. This is temporal bone. This is the parietal bone. This is the frontal bone. This is the occipital bone. This is the zygomatic bone. This is maxillary bone. These all are the teeth embedded in the teeth socket by the fibrous joint. This is jawbone. This is the alveoli of the teeth. In this alveoli, these teeth are embedded by fibrous joint. In the whole cranium, fibrous joints are present by sutures. These all are the sutures. This is temporal bone, ischiumous suture, coronal sagittal suture. This is lambdoid suture. This is the coronal suture. All are the fibrous joint. Let me come on second joint. Second type of the joint, slightly movable joint, means cartilaginous joint. Cartilaginous joint are the bones at the slightly movable joint can only move a little. They are held together by strong straps called ligaments. Cartilaginous joints are held by the ligaments, which allowed only slightly little movement. This does not permit free movable. And cartilages is the pad-like structure which involves in between two bones of the joint, just like in ribs and vertebra. In the ribs and vertebra, these all are the cartilaginous joint, which held together by the ligaments. You can see here, these are the cartilages. These are the cartilages. You can see between the vertebra. These are the cartilages. This is bluish in color. These are the cartilages, which joints together two bones, two vertebra, two ribs. This is sternum and this is vertebra, joined by the cartilages, fibrous cartilage. These joints मूवमेंट तो करवाते हैं लेकिन बहुत ही थोड़ा मूवमेंट करवाते हैं. लिटिल बिट मूवमेंट्स allowed by these joints. So, very interesting thing. Let me come on third type of the joint, which is freely movable joint or synovial joint. जैसा कि इसका नाम है freely movable joint, it allowed free movement of the bones, which permits bidirectional and multidirectional movement. At the free movable joints, the bones move freely. They are also known as the synovial joint and are the largest group of the joints found in the body. These type of the joints are in bulk in our body are found. Majority of the joints is synovial joint in our body. So hip joint, shoulder joint, knee joint, and all other joints are synovial joints. This is hip joint, this is synovial joint. This is knee joint, synovial joint. These are the elbow joint, synovial joint. This is the pectoral joint, synovial joint. These are the phalangeal joint, synovial joint. This is the wrist joint, synovial. All are the this is joint between head and vertebral column. This is a synovial joint. All are the joints of the synovial joints, group of the synovial joint. So this is very interesting joint, and most of the questions comes this group of the joint. In this category, many types of the joints are present. So we will discussing about this. Synovial joint, ball socket joint, hinge joint, pivot joint, gliding joint, saddle joint. These all are joints are discussing in detail. So let me focus on these joints. Hinge joint, ball and socket joint, pivot joint, saddle joint. We are discussing in detail. Synovial joints are of six types: ball socket joint, hinge joint, pivot joint, gliding joint, saddle joint, and condyloid joint. Ball socket joints are present between head of humerus and glenoid cavity of pectoral girdle, and between hip bone, head of femur, and cavity of the pelvic girdle. And this is hinge joint. Knee joint is the hinge joint, and here you can see this patella. And elbow joint. Elbow joint also is a hinge joint, and hinge joint also present between the interphalangeal joint is the hinge joint. Interphalangeal joint is the hinge joint. Pivot joint. Pivot joint are present between atlas of the vertebral column and skull. And one more pivot joint are present between head of radius and ulna. This is the very important point. This question asked by many times in examination, competitive examinations. This is very important. This is phalange. These are the phalanges: distal phalanges, middle phalanges, and proximal phalanges. This is distal phalanges, middle phalanges, and proximal phalanges. But here, distal phalanges and proximal phalanges in the thumb, not middle phalanges. These all are the joints are hinge joints, and this is carpal joints. Carpal joints are gliding joints. These all are the gliding joints, and in the case of tarsals, or tarsals also is a gliding joint. Saddle joints. Saddle joints. Saddle joints are provide stability to the bones while providing more flexibility than the hinge and gliding joint. So this is a very important joint. Very important joint. Saddle joints allowed adduction, abduction, elevation, supination, pronation, etc. So this is the very important joint of our body. And condyloid joint. Condyloid joint are involved the condyloid. As you see in the case of jawbone and temporal bone, this is the condyloid joint. Condyloid joint is a very interesting joints which allowed in the only unipolar movement. Yeah, single plane movement. This is also an important joint. This is the ball and socket joint. This is the ball and socket joint. Hip bone. This is the hip bone, head of femur, and acetabular cavity of the hip bone. So this is the ball and socket joint. This type of the joint are present in the hip and shoulder. Shoulder joint also is a ball and socket joint between head of humerus and glenoid cavity of pectoral girdle. Yeah, scapular bone. Condyloid joint. Condyloid joint between metacarpals and phalanges. Condyloid joint are present two places. Metacarpals and phalanges, metatarsals and phalanges, and jawbone and temporal bone. Between jaw and temporal bone. So this is very important joint and many questions come from here also. Elbow joint. Elbow joint is the very important joint of our limbs. Hinge joint, trochlea of the humerus and trochlear notch of the ulna. These joints are present between trochlea of humerus and trochlear notch of the ulna. And gliding joint, capitulum of the humerus and head of the radius. This is the gliding joint, head of radius and capitulum of the humerus. Flexation, extension, these are the capability of this joint. Only flexion and extension. Many reinforced ligament and stable joint. These are the stable joint. इसमें बहुत सारे ligaments पाए जाते हैं. Let me show you this the humerus joints capsule. This is the synovial membrane filled with synovial fluid. This is a joint cavity. This is the articular cartilage. This side. This is the trochlea. This is trochlea. This is radius. This is ulna. Or this is the olecranon process of the ulna. Ulnar olecranon process. These joints are present between humerus and ulna, not between radius. You can see here. Hip joint. Hip joint is also a ball and socket joint. Knee joint. As you see, elbow joint. This is knee joint. Knee joints also is a hinge joint. This is the large joint, complex also. Median and lateral condylite of the distal end of the femur. Distal end of the femur. Okay? This is the condyle of the femur. This is the medial condyle. This is the lateral condyle. It allows the flexion and extension, little rotation. This allowed little rotation, but flexion and extension is the main property of this joint. This is the very interesting. This is the joint cavity, means synovial cavity, okay, filled with synovial fluid. This is the synovial membrane. This is dark in color. This is synovial membrane. This is synovial membrane. This is meniscus. Meniscal. This is infrapatellar bursa. Bursa is the depression which is filled with fluid, and it involved in the comparatively movement, because bursa help in the free movement of the joint. Mobility of the joint is mainly depend on the fluid filled cavity and fluid present between the cavity. So this is the very interesting. This is patella, this is the femur, and this side condyle of the femur. This joint, mainly in this joint, many diseases are occurs because disorder of the joints are mostly found in body, and mostly knee joint and elbow joints are involved in the disorders. You can see all joints: pivot joint, hinge joint, saddle joint, plane joint, condyloid joint, and ball and socket joint. These all joints are synovial joints. In the pivot joint between vertebra. In the end, pivot joint, this is the atlas, and this is the condyloid of the skull. In between these two bones, atlas tuberosity rotate between condyloids. This is the pivot joint. Hinge joint. Hinge joint present between humerus and ulna. Humerus and ulna, and femur and tibia. One bone glide over other bone. So in this bone, synovial fluid and synovial cavity are present. Saddle joint. Saddle joints are present between metacarpals and carpals. In this joint, synovial fluid are not present, not cavity, but one bone glide over another bone. Plane joint. Plane joint between tarsals. One bone slide over another bone. Condyloid joint. Condyloid joint. Condyloid joint present between metacarpal and phalanges. Metacarpal and phalangeal joint is the condyloid joint. One condyle of the bone hinge with another condyle of the joint. So this is the condyloid joint. Ball and socket joint. These joints are present between the hip and femur. Hip bone and femur bone, and humerus bone and scapular bone. So this is the ball socket joint, and this permits all directional movement. This is three-dimensional joints, and it allowed three-dimensional movement. These all are the joints. So let me come on next topic: disorders of the skeletal system and muscles. Disorders of the muscles and skeletal system. So in the disorders at the standard of the 12th, these six or some other disorders are in the discussion. So we will discuss about myasthenia gravis. Myasthenia gravis is the autoimmune disorder, and these all diseases are mostly put up by the examination, because examiner always want to ask about some interesting things. So myasthenia gravis is the autoimmune disease. In this disease, autoimmune disease, normal communication between nerves and muscles are affected. And due to this, muscles fatiguing or weakening of the muscles or paralysis of the skeletal muscles are takes place. Neuromuscular junction. Neuromuscular junction. These are affected by this disorder. So, communication between muscle and nerves are broken, and this type of disorder are takes place. In this case, just like communication, swallowing, eyelids movement, and all facial expressions and body postures are disturbed. It's a very difficult disease and very problematic, and no treatment of this disease, only little bit treatment, and completely cure are not present. Muscular dystrophy. Muscular dystrophy is a genetic disorder. This is autoimmune disorder. This is genetic disorder. This is progressive degeneration of the skeletal muscle, mostly due to genetic disorder. So, muscular dystrophy is inherited, means it transmitted from one generation to another generation, and this disorder lead to the muscular weakening and increased level of disability, means difficulty in the movement of the limbs and other organs, because muscles weakening are takes place. Tetany. Tetany. Tetany means, in other word, tetanus. This is the very tetany is a rapid sperm, means wild contraction. This is a strong contraction of the muscles due to the low calcium ion in the body fluid. In the body fluid, low calcium ion lead to the rapid spasm of the muscle. That means that means hyperexcitability of the central and peripheral nervous system, which result in the reduction in the calcium and magnesium ion movement in the body fluid and lead to the muscle contractility. And this is like paralyzed, and not like paralyzed. This does not allow any movement, and strongly it held the muscles and body movement does not take place. Arthritis. Arthritis is easier. You can see inflammation of the joints. In the case of arthritis, body fluid reduced. Arthritis, joints inflammation are takes place because damaging of the tissue around the joint lead to the these disorder. You listen many times, आपने देखा होगा, pain of the joints are takes place in the humans. This is the arthritis, and connective tissue of these positions lead to the fatting and degeneration and damaging. So this is the very common type of the disorder. Type of arthritis you can see, but rheumatoid arthritis is more common. Osteoporosis. Osteoporosis is the age-related disorder characterized by the decreased bone mass and increased chances of fracture. This type of the disorder are mostly found in the women. because decreased level of estrogen is the main cause of this disease. In the women, after the menopause, estrogen level becomes decreases, and due to decreased level of estrogen lead to the bones degeneration and increased chances of the fracture because bone mass decreases and lead to the bones fracture. Chances very high of the fracture of the bones in older ladies. In men and or male, this type of disease is in the low level. Got inflammation of the joint due to the accumulation of the uric acid crystals. Uric acid crystals are accumulate in the synovial cavity where fluid are present. So this type of the disorder are generally takes place in the workers which lead to the heavy work. In the case of in our body, oxidation of the body's important minerals and other fat and some other things are takes place, and in the absence or low level of oxygen and high work of the muscles, formation of the uric acid crystals are takes place. Due to this and due to that, this type of the inflammation are takes place and happens, so lead to the ghost disease. These all are the very interesting topic. So I hope you enjoy this topic, and I wish your success, and please like, subscribe and share my channel, and I hope you drop comment our comment box. So please subscribe my channel, and we will once again present you new topic. So goodbye, take care, bye bye.